are you worried about?
Me worried? Me.
If you tell the people here, say that you fall or your chest hurts or something like that, what do you think is going to happen?
They'll kick me in the butt.
You have some ordered as needed too. So if you're having more pain.
I don't get paid much.
Okay. Okay.
I had to take a nitro night before last. Yeah. And this is the one that's up on the wall back there.
Mm-hmm.
Look at the head of hair and all the pretty girls.
I see.
Yep.
You're always surrounded by women.
Always. That's my life.
We'll do an instrumental where you'll speak the first verse.
Yes.
I'll sing the first verse.
Yeah.
You speak the second verse, and we can sing.
Wherever you're going, I'm going your way.
Moon river, wider than a mile, I'm crossing you in style someday.
This is the way life goes. You know, we're born and we live a life, and hopefully we're kind and helpful to others, and we get to the point where our time is close. And
I'm smiling because this is exactly how your dad talks, and you know that because that's where you learned this from.
That's right.
Yeah.
That's right.
And we thank you especially that hospice is willing to come and do these things for us too. They are greatly appreciated.
You want to close with the song?
You know it too, don't you?
Which one? Stardust?
Huh.
Yeah.
Oh, I don't sing well. You do.
I'll carry you.
You do. Carry me.
You ready?
Yes.
Though I dream in vain, in my heart
you
it will remain my stardust melody, the memory of love's refrain.
Awful pitch. Norman will get sick to his stomach when he hears that.
Have you not been honest with me?
What?
Have you not been honest?
About sleeping?
My father said honesty is the best policy. And I think that rules are made to be bent.
Are you a little short of breath today?
Well, I am somewhat, yeah. I almost asked for a nitro, but it's hard work to talk and breathe, so it's work.
He was thinking of asking for a nitro earlier, he said. So I just wanted to let you know that. She's here right now, and if you say the readings out loud, Tori, I can tell him to sue.
All those things. Come in.
I got 98 over 54.
What?
It's a little low, isn't it?
They gave him he had some chest pain. He usually doesn't complain. And they gave him the 3 things of nitro. But then when they went, we did have the nurse go see him, but by that time he calmed down a lot and he was going to eat something.
Came back positive, I heard. What does that mean?
It shows that you have lung disease, like a COPD they call it, chronic lung disease, so they can see some changes which are consistent with what you know that you have. So we've been seeing you for quite a while now, or at least
Hospice you're talking about?
hospice, yeah.
I consider it just a blessing that you guys came.
Abigail Unger is a new friend of ours here at the Greenfields, and she will now sing a familiar favorite and a personal favorite, honestly, of mine, called Moon River, with a gentleman that needs no introduction here at the Greenfields, Milton Show.
We're after seeing rainbows waiting around the bend. My huckleberry friend, Moon River, and me.
yes.
It's from everyone from hospice.
I thought the two of you up there were fabulous, and everybody did.
Yes.
Very impressive.
I was wondering, why me, Lord? Why have I got all this attention? You got... Yeah.
You deserve nothing less, Milton.
Apple cider. Up that cord on my neck. Boy.
Just think how much work those darn fingers have done.
Yeah.
How many things you've planted and how many things... You play the piano, right?
I had my blood pressure taken a couple of times. Geez, I had one day I was so weak and but it was like 92 over 50 or 48.
Yeah, was that the day that Rose was here and she gave me a call?
Yes, I think so.
Milton, does it hurt?
Oh,
Okay, one more.
that's it. I should get up and walk. Walking makes me terribly tired.
When people ask me if my job is depressing, what I often respond with is, it's depressing to think of people who pass without hospice. It can be a very rewarding experience. We never see our patients cured, but we see them heal. And when we can see a patient pass at peace and see family members get to do last goodbyes and spend some quality days, if we could manage symptoms and make somebody comfortable to give them a few extra weeks with family, there's nothing depressing about that. It's very uplifting.
He could not get up and really walk any further than from one side of the room to the other. He gets about in his electric scooter, so I mean he's still out and about, but he recognizes that he's feeling slowed down. He had some family come in. He went out to lunch. He was gone about 2 hours, and it just wiped him out for the rest of the day. He complains a little bit more of neck pain to the neck fracture, but he's also trying to not wear his brace as much as he was because it's starting to affect his swallowing.
I have a tendency to fall yet, and I have to be very careful that I always hang on to something. But then they gave me that liquid that you put under your tongue or whatever with
Seroxanol.
Yep. I guess it must have been.
Yep, that's the liquid morphine goes underneath your tongue.
Yeah.
Did that help?
Well, evidently it helped because I went to sleep then too.
Tell me about what happened that brought you in here on the Friday.
Well, I was having some chest pains. I took one nitro and then the second one. And of course, at Greenfields, the rule is if you take 2 nitros, that's it, you get out of here.
That's your ticket out?
Yeah, well.
Yeah, I'm the one actually that got the call on this. I didn't want to see him go to the hospital. You've had angina before?
Oh, yeah.
Did it feel like that?
Yeah, pretty much.
Okay. So it felt like pressure, like when you put your hand on your chest?
No, I've never felt like that.
Okay, what did it feel like?
Well, it was just a pain, an aching right in here.
Okay. Not down here, though. About 30% of chest pain is actually reflux pain,
That's
and
right.
it can mimic it. And the problem is nitroglycerin gets rid of that, too.
Oh, yeah.
Yeah, nitroglycerin relaxes muscles, and when you get reflux, your esophagus squeezes, and it feels right here. It'll hurt right here.
We can take care of the person as a whole, mind and body as a whole, within the context of family, as a whole within the context of their home. So you're not looking at an organ system. You're not looking at a moment in time in a clinic. That we offer a spectrum of services and a model of care 24 hours a day, meeting them on their turf, in their way, and that's pretty spectacular.
It's not intimidating coming here. I think after you've been here and seen we're all right.
Well, that's
it's not like a hospital that you'll sleep better. You know? Good. Are you cold a lot of the time?
Yeah, the feet are, yeah.
Yeah, then. Well, good news is we're getting you out of here.
Oh, of course.
All right?
That would be fine.
All right. Well, I'm glad we were able to help you and avoid the hospital trip.
He just loves hospice. He keeps saying, I don't know what I did to deserve all of you wonderful people. And he says that, whereas a lot of people say, why is God doing this to me? That's Milton. That's the difference between he and a lot of people. Yeah.
Good morning.
Wonderful.
Now you can see
Thank
the
you very
history.
much. At early dawn is azure blue, and the air is crisp and cool. You think it is fall. When the sky at early dawn is azure blue, and the air is crisp and cool, you think it's fall. Oh.
Don't do it. You almost offensed me and keep going. That was good. Touche.